Yeah, welcome back. Today we are going to start with ophthalmology. So first topic we are going to take is ptosis. No worries, we'll cover anatomy in upcoming sessions so that there will be no doubt with the anatomy portion. So first we'll go with the simple topic called as ptosis. Okay, make a heading ptosis. What do you mean by ptosis? Anyone? Yeah, it's a drooping of eyelid. सबको पता है ना eyelid तो eyelid where it is and all. We'll study the detailed section of this eyelid in our one separate video called under the playlist of anatomy in ophthalmology. Okay, so proceeding, ptosis, drooping of eyelid. Here we have two types, maybe congenital. Yeah, ptosis is a abnormal, it's not a normal, right? Yeah, so causes we have acquired or it may be congenital. पहले congenital देख लेते. Yeah, in congenital we have two types. It may be simple, then it is complicated. Okay, so in simple what happens? Levator palpebris superioris muscle is dystrophy. So what happens? Absence of lid crease, lid lag sign, which will be seen. Okay, in complicated it is always associated with something other, some other disease, like make it as a like associated with blepharophimosis syndrome, one condition. Then other one example is Marcus gun jaw winking. Yeah, in the name only it is there. Whenever there is a movement of jaw, if you move the jaw so that blinking of eye takes place. लड़के को आंख मारने जैसा लगता है भाई, उसका गलती नहीं है, वो कंजेनाइटल है, राइट? या then in coming to acquired we have neurogenic. Yeah, it's like 3rd years, like this is a important 3 marker. What is the causes of what are the causes of ptosis? So you have to classify neatly and write the causes. So to fetch the 3 marker you can't make it wrong, right? Neurogenic ptosis we have two. There are many examples, but we'll write the basic necessity or like important examples under the headings, right? It's a third nerve palsy. Then we have Horner syndrome. Then which type? Myogenic type. In the name only you can understand like what is the main cause. And diseases like dystrophy, you can't miss out dystrophies, right? Dystrophy and myasthenia gravis. Then we have mechanical ptosis. Under that we have eyelid edema, or it may be eyelid tumor. TM means tumor. Large calazion. The calazion we will study deeply in our further sessions. It is also a 5 marker for 3rd years. Okay, then we have 1/4 idiopathic. Idiopathic तो उनको ही पता नहीं है, हमको क्या पता, right? We have another name for it, aponeurotic ptosis. Okay, why it is happening? Senile, most common. What is the meaning of senile? Anyone? Old age, right? Old age. In this, what happens? High eyelid crease is an important sign. Okay, so this was our structurized classification of causes of ptosis. Then further we will go with the what is the basic difference of this congenital and senile, so that we won't get confused. That is an important topic even for a third years or entrance exam. So make a heading congenital ptosis on the one side of the table, then other side senile aponeurotic ptosis, right? We saw this under the idiopathic section. So first point, LPS muscle maldeveloped. So the main muscle which is like related to ptosis is only maldeveloped. Okay, here it may be normal or there may be tendon affected. Then here LPS if present or formed, action may be reduced. Here action will be normal. This is due to like senile is like due to old age, right? So function will be normal. And this LPS crease, it is absent, and I discussed about this, it is normal above there, right? Then fourth point, lid lag sign. Yeah, we made this point there. Lid lag sign is positive in congenital, whereas it is negative in senile, right? So we looked into the difference between congenital and senile. So next we'll look into the assessment of ptosis. People are noting, right? Make a good notes of ophthalmology. Why I am saying, you will come to know. Third years, it make you cry in the last day of the exam. Okay. So make a simple structure of a eye. Yeah, I am not a good artist. Adjust. Yeah, this is our eye, eyelid and the cornea. Then here what we are going to measure is marginal reflex distance, MRD. Okay, where we will be using this MRD short form. So we have two grades, 1, 2. So MRD1, MRD2. So MRD1, it is the distance between upper eyelid margin center to cornea light reflex. So usually what will be the distance? 4 to 5 centimeter. See, take this as a point. Let's make it a color, different color. So this is your MRD1. Why this distance is important, we'll discuss in further like we'll check the severity of the ptosis. There we'll study this. Remember this, normal is 4 to 5 centimeter. Then MRD2, as usual, the remaining portion, right, to the lower eyelid margin. This is the eyelid which covers the like which is the skin portion which is covering our eye is a lid. Okay, that is the basic. Don't get confused with the lid, meaning of the lid. Central corneal light reflex and center of lower eyelid margin distance. Okay, I hope there is no doubt in this assessment of ptosis. Then coming to how much it happened, ptosis. So amount of ptosis, we have mild, moderate, severe. Mild, moderate and severe. Okay, so I said MRD 1 is 4 to 5 centimeter, right, and MRD 2 is not that important because it doesn't get affected, right? Usually the upper eyelid is going to droop. So first one, like maybe less than or equal to 2 mm of droop. So like first we'll write, then I'll explain the meaning of this. Then 3 mm of droop, then more than 4 mm of droop. So what happens, this is your normal eye. Okay, this is your normal eye, upper eyelid is intact, so it is above the lid, right? Then what happens if ptosis happens, this eyelid is there na, like let's make a eye, this is the lid, right? What happens, due to this LPS muscle defect, eyelid may come here, so this much portion is going to be covered, so there will be a vision loss, right? Initially it was here, then it came to here, then it may come here, right? So this distance we are saying, like that we wrote in severity, like amount of ptosis, we wrote 2 mm, 3 mm, 4 mm. So this is the distance. Okay, I hope that was like helping. So next, write a basic concept under this topic itself, function of LPS. So how you are going to check the function of the LPS? Method. So there may be some method, right? Method used is Burke's method. Usually normal will be more than 15 mm, good 8 to 15 mm, fair 4 to 8 mm, and last poor less than 4 mm. Okay, so we diagnosed, or like it is like an investigation, so we did the test and we came to know the function, the amount of ptosis we got and everything. So now we are going to treatment part. Treatment of ptosis is an important topic. So as we discussed, it will be divided into congenital and acquired. Congenital and acquired. Okay, first we'll discuss the acquired portion. So you have to check what is the underlying cause. check for the underlying cause and they treat that underlying cause. For senile ptosis, what is the another name we said for this senile ptosis? Yeah, anyone? Yeah, I already almost wrote the answer. Aponeurotic, right? So there is some defect with the aponeurotic, so we'll do, yeah, aponeurotic repair, right? So you have to remember the other name just because of this part. Yeah, right. And then coming to Horner syndrome, yeah, this is a like important topic. Horner syndrome, we have a triad for this. Yeah, we'll discuss this in a separate video detailedly so that you won't miss out. Yeah, Horner syndrome we are going to discuss in a separate video detailedly. Okay, it is due to neurogenic cause, right? Neurogenic ptosis. So what we are going to do is fascinella servat operation or mullerectomy. Then important topic is like myasthenia gravis. MG means myasthenia gravis. So in this we give edrophonium tensilon test, you remember, right? Yes, it improves. So coming to your congenital portion, so here the aim will be to increase LPS strength. Yeah, that in senile and all action will be normal, but here it will be reduced. So we have to strengthen the LPS muscle so that ptosis will be reduced. So in mild, which is of less than or equal to 2 mm, we do LPS ligation or similar to that Fasanella servat operation. Okay, then in moderate 3 mm, similar LPS resection. Then in severe condition, which will be more than 4 mm, we do LPS replacement. Why we do complete replacement? Any idea why? Because there will be complete poor LPS action. So here LPS replacement, we have facial lata sling operation. So what is meaning of this is like basically we'll consider this as a frontalis. Okay, we just like hanging this muscle. LPS muscle with the help of sling. So attached may be silicone or it may be facial lata. Where you'll see this facial lata? The leg, right? Lateral wall of lower limb. Okay, so we saw the simple two. Then coming to complicated one, Here we have complicated is nothing but we operated something and it happened something. So one such complication is Marcus gun jaw winking phenomena. Yeah, I said ना, लड़की को आंख मत मारो नहीं तो आंख निकल जाएगा. Right? Just kidding guys, don't take it serious. It's your choice. Pterygoids, fifth nerve, abnormal innervation happens LPS, over the LPS. So what happens? Jaw movement shows eye winking up and down with the jaw, right? So what is, so you are seeing someone is like blinking eyes, ladki ko aankh mara something. So what his father will do now, he'll take him to ophthalmologist. Then after coming to know okay बच्चे का mistake नहीं है, so he'll offer a treatment method which is like just disinsertion from burses with replacement of frontalis sling, so that he should not do the same thing with the other guys, other girls, not guys, right? Yeah, that was all about ptosis. So quickly we'll go with your revise so that you don't miss out the last minute revision. We today in this video we learned about ptosis, which means drooping of eyelids. We have congenital, then acquired. In congenital we have simple, complicated, complicated associated with syndromes and Marcus gun jaw winking. Then in acquired we have neurogenic ptosis. Examples you need to study well. Third nerve palsy, Horner syndrome, we'll study that in detail. Then myogenic ptosis, in that we'll myotonic dystrophy. Then myasthenia gravis you're going to learn in every subject very detailedly, very important topic, and we will make sure that you won't miss out any important topic in any of the chapter related to myasthenia gravis. I'll be teaching you well. Okay, then mechanical ptosis, we have eyelid edema, tumor, large chalcinogen. Chalcinogen you are going to study here itself. It's a good important topic for third years and even for competitive exams. Then idiopathic ptosis, which is also called as aponeurotic ptosis. I said why you want to remember the another name. And in that we have senile. It is called as old age, like you will see in this in old age. This is the most common idiopathic. Why and one more point you need to remember under this is eyelid crease is positive. So then we saw the difference between congenital ptosis and senile ptosis. Go through this, very important. One important part is LPS action will be reduced and there will be lid lag sign, and here it won't be lid lag sign. So LPS action reduced, why it is important, we'll study that in further. Assessment of ptosis we studied. MRD is nothing but a marginal reflex distance. So this was the distance which is important for us. Okay, which is normal level will be 4 to 5 centimeter. Then coming to amount of ptosis we studied, it is mild, moderate, severe, 2, 3, 4. 2, 3, 4, right? 2, 3, 4. Then we studied a function of LPS, which normal is 15, poor is 4. Okay. Then we studied about treatment. First we studied about congenital. Like basically there is some I said like action will be reduced in the difference between senile and congenital, so LPS strength should be increased. How? It depends on the ptosis level. So mild, moderate, severe, we have different treatment. LPS pication, fascinella savate operation, LPS resection, LPS replacement. It is a bigger one. It is the last thing which happens with the LPS. So facial lata sling operation, name of that surgery. Then coming to acquired, check for the underlying cause, treat that. In senile ptosis, aponeurotic repair should be done. In Horner syndrome, we do that as usual, that facinella sevata operation or mullarectomy. In myasthenia gravis, we give hydrophonium, which improves the condition. And in complicated, we learned ladki ko aankh mat marna, like do whatever you want. Just remember Marcus gun winking phenomena. And we said father is the one किसको तुम आंख मारे थे उसका बाप तुम्हें इलाज करवाएगा, राइट? Yeah, that's it. Don't take any jokes serious. Yeah, this was all about ptosis, and study this topic, very important topic. And don't forget to subscribe. Yeah, right? Many people just watch my video and go out. Like if you subscribe, you'll get motivation, right? Yeah, that's it for the video. Guys, you can comment me, like you can use my comment section whichever topic you wanted me to do earlier, so that I'll teach you the topic which you suggest me. Even it's a huge topics, like I can't decide which topic to teach first and later. So if you want any personal, like if you want to learn any particular topic in a particular subject, you can comment me that in this video, so that I'll take up that topic prior to the other topics which I wanted to teach. Yeah, that's it. Have a great day, have a fun, enjoy the subject. Okay, bye.